You've brought up that hydration piece a couple times, so obviously really important. And I know from a general sense, health and wellness to maintain that, you want to be hydrated. But does that become more important when somebody's adopting a ketogenic diet?
It does that, and the salts too. So you want to stay well hydrated, because that just all our systems are water-based systems, and it just, the more water is great. It helps with your kidney function, helps flush out any toxins or any thing you don't want, any excess that's in your body, your kidneys deal with, right? Or your liver, sometimes your lungs. But also salt. So one of the things that you have to be wary of is, and this is something that that almost no clinical practitioners or physicians are aware of, is the effect of insulin on salt regulation. And when I say salt, I'm talking about sodium. So one of the powerful effects of insulin, I didn't mention earlier, is it reabsorbs salt from the kidneys. So that means the salt is coming from the urine back into the kidneys, from what will be the urine, back into the blood, rather, excuse me. And where salt goes, water follows. So when you have insulin that's too high, you're reabsorbing too much salt and you're reabsorbing too much water. And what that does is that salt and water has to go somewhere. It goes in your blood vessels. And so you're adding volume to your blood vessels. And that's a closed system. So there's a physics law about blood flow called Poiseuille's law. And what it says is that your blood pressure is directly proportional to your blood volume. And that's why physicians, when you have high blood pressure, the first thing they say is, well, let's get salt out of your diet, sodium, because they know then the water will follow out and that'll lower your blood volume. Or they might prescribe something like hydrochlorothiazide, which is a diuretic, which will make you pee that extra volume out. But you're kind of dehydrating yourself when you do that. And so when you adopt a ketogenic diet and you're moderating your insulin levels, excess salt is going to leave the system, and you probably need to add salt to your diet. So if you feel a craving for salty things, eat them. And that's just sodium salt. There's also potassium salt, magnesium salt, calcium salts, and so on. The other two that I think are, well, I'll just talk about one today, is magnesium. Magnesium has about over 200 different important metabolic functions. It's not metabolized for energy, but it combines with other elements, and it's involved in the metabolism in an important way. Most people are magnesium deficient, and so you should add salt when you want. And by the way, the recommendations for salt, again, the public health recommendations are probably way too low if you have a healthy diet. I don't think, again, they're looking at it in terms of lowering blood volume, and you can do that with a ketogenic diet anyway. And you probably don't need a diuretic if you have high blood. That's why people that are hypertensive, they might have to reduce their antihypertensive medication, because they're correcting it by correcting their insulin levels in the blood, and that corrects their salt levels. So going back to a healthy body, right? So magnesium, the one I recommend is called magnesium bisglycinate. And the reason for that is some formulations of magnesia affect your digestive system. You don't want magnesium oxalate, which is milk of magnesia. That it's a anti-constipation kind of thing. You don't want that. That can have the same effect as MCT oil for some people. But magnesium bisglycinate is a formulation that is easily absorbed without upsetting your stomach. And it's actually, and I'm still experimenting with this myself, there is suggestion, I would say, that it can help you sleep, help improve your sleep. So what I do is I take it right when I go to bed. I have my glass of water there, and I take my magnesium bisglycinate, and it's not very expensive, and I take that once a day. And I make sure I have lots of potassium too. It's hard to take that in tablet form because you need a lot of potassium, like about 3 grams a day. And if you're taking that in tablets, it'd be about 30 tablets. So don't try and do it with tablets. Just eat foods that are high in potassium that aren't starchy. Most meats are pretty good for that. And then the salt, just be liberal with the salt shaker. And a lot of those symptoms people experience during the adaptation period, the lightheadedness, the dizziness, headaches, digestive issues, are because their salts are unbalanced. So my theory is, again, I'm not a physician, is just get more than you need and let your kidneys sort it out. And as long as you're drinking lots of water with it, your kidneys will be just fine.
I'm so glad you brought up that salt piece. I wanted to make sure we covered that. So just to highlight what you said there, when you go lower carb, insulin's going to come down. we're going to expel more salt, which is going to take water from it. So we're going to want to take in more salt through the diet and water to stay hydrated.
Yep, to stay hydrated, and it also help moderate your blood pressure. I mean, one of the things that happened very rapidly, very consistently, as well as decreased blood sugar, is decreased blood pressure with people that adopt a ketogenic diet. So you don't want your blood pressure to go too low, which is why you have to have this concomitant reduction of antihypertensive drugs, or just don't use them. If it's a diuretic, you're probably not going to benefit. But again, I'm not a physician, so this isn't medical advice. I'm just sort of thinking scientifically about it. But it's funny because I've talked to physicians groups and none of them ever learned that insulin causes salt reabsorption. It's pretty important because managing salts is pretty important. That's what Jeff Volek always says, get the salts right. Make sure you get the salts right, and then you won't have any of those side effects. So I have a little section in my book about that too.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
7 out of 8 people are overweight or obese, which means they're metabolically unhealthy, which means they're sick. We have a phrase in kinesiology, you cannot outrun your fork. A bad diet is not corrected by a lot of exercise. And we know it's really effective at reducing obesity.